COVID-19 cases in Indonesia, especially in the capital Jakarta, are rising again, with 2 patients died. To know more about this, now live with us by Zoom, Dr. Siti Nadia Tarmizi, Head of Communication and Public Service Bureau at the Ministry of Health. Hello, Ibu Nadia. Thank you for joining us. Ibu, let me ask you, my first questions is about how significant is the increase of the COVID cases in Jakarta specifically, and what's causing it, Ibu Nadia?
Yeah, good afternoon. Is it my voice is okay?
Yes, Ibu, we can hear you. Ibu Nadia, can you hear us, Ibu? My apology, I think we've... Hello?
Hello, Mas Uli. Good afternoon.
Yes, Ibu. Thank you for joining us, Ibu. So, if you can hear us, how significant is the increase of COVID cases in Jakarta specifically, and what's causing it, Ibu?
Yeah, I think same with the global situation, we can see there is a rising number of COVID-19. It's mostly caused of a new subvariant of the Omicron. We know that XBB 1.5 and EG2, EG5, which currently are mostly the subvariant circulate in many countries globally, including in Indonesia, and of course, including in Jakarta, are most subvariant that cause increasing number in Jakarta.
Ibu, is there any more detailed information about the 2 COVID patients who passed away, Ibu?
Yeah, in fact, the death case is not new cases during this period, because the 2 cases that reported by Jakarta, it happened in Jakarta. But previously, we have a number of death cases around 0 to 3 since the end of the pandemic COVID-19. So it's not mean that before the Jakarta report there is 2 cases, there is a 0 case COVID-19, because we know that other provinces reported a case of death case of COVID-19 too.
Ibu, regarding the free COVID-19 vaccines provided by the government until December this year, is there any chance that this free COVID vaccine program will be extended if the cases keep on fluctuating, Ibu?
We can see what happened, yeah, but mostly it will not the fact that mostly the vaccine will not available for all the age group, because even WHO already recommended that COVID-19 vaccine is only for the higher risk group of population, all elderly. So that's why in 2024, the COVID-19 will be only aimed for the high-risk groups, such as the people who have hypertension, diabetic, or other comorbid diseases, and for the elderly. That's why we are encourage Indonesian citizens to complete their vaccination up to the 2nd booster.
Last question, Ibu. What must the public know to keep themselves safe and prevent them from being contracted by this variant of virus, especially nearing the year-end holiday?
Yeah, we know there is a new subvariant circulate in the most countries. So what we have to do is to prevent, to take care ourselves not to get infected by COVID-19. So that's why the first one we have to do is completing the vaccination. Second, you have to wear mask. So we encourage our citizens to have a mask during their activities in the public. And then when they have a symptoms such as coughing, sneezing, or fever, all the symptoms like flu, we are encourage everyone to wear this mask. It will prevent not only for COVID-19, but other influenza diseases. And third, we are encouraged to do the hand washing practice again. Don't forget it, because most people already not practicing this hand washing. And then the 5th one I think if you don't have any emergency to travel around the country or even outside the country, try to prevent the country who have a increasing number of COVID-19.
Ibu
And
Siti
lastly,
Nadia,
of course,
okay,
yeah, sorry. And
sorry,
lastly, of
sorry.
course, if you have the and lastly, of course, if you have the symptoms, you have to take a COVID-19 test.
Okay.
Thank you.
Ibu Siti Nadia Tarmizi, we thank you for your time and we wish you all the best and stay healthy, and we will definitely contact you again for updates in the future. Thank you, Ibu.